Our newsmaker this hour, Dr. Marty Makary, the FDA commissioner, marking his first 100 days on the job. It's been a busy few months with many changes at the agency, from vaccines to staffing. Good morning, doctor.
Good morning, Joe.
Maybe you've been on a few times. I don't remember, but we all went through that period together, obviously, and there's a lot of a look back now at that period. And I was, it's a hot button issue, and sometimes it's tough to talk about. And there's conspiracies and controversies. I think of Novak Djokovic. Right now, he's going to be in the finals, I think, at Wimbledon. And at the time, I wondered about his decision, the decision of tennis. What do we know now, doctor, in your view, about what we should have done with COVID? Should healthy people have been not forced, but strongly coerced to take that? At the time, I thought it was a game changer and a lifesaver.
Well, look, Joe, I had said during the time of the pandemic that if we have vaccine mandates for young, healthy individuals, we were going to see a rise of an anti-vaccine sentiment, and I think that's exactly what happened. We saw a tremendous loss in public trust. A study in JAMA found that 71% of people trusted their doctors and hospitals before the COVID pandemic, and that's down to 40%. That's a 31-point drop. And I think it was from ignoring natural immunity. I think it was from vaccine mandates insisting that soldiers and firefighters and teachers be fired if they don't have the vaccine, even if they were young and healthy and had the infection already. They had circulating antibodies that could neutralize the virus, but they were antibodies the government did not recognize because it failed to recognize natural immunity. So we lost a lot of ground in public trust, and we're trying to rebuild that now through radical transparency and being very honest and telling people the government is not your doctor. Talk to your doctor and get good advice from your doctor's wisdom and judgment.
There are some changes at the Vaccine Advisory Committee that a lot of hand-wringing and consternation about the new members. Is it anti-vax, doctor, would you say? Or how would you describe your approach to preemptive disease management?
Well, look, I think over at CDC, a different agency, they do have a reconstituted ACIP committee with a diversity of views among people who do believe that vaccines save lives. The past committee had pushed for COVID boosters in young, healthy people. And of course, that is probably why we see such a backlash today. There was never great evidence for repeat boosters in young, healthy children. As a matter of fact, there was a myocarditis risk that was largely downplayed in young males. And I think if you look at the track record of that committee, there's a reason why 85% of healthcare workers did not get a COVID booster last fall. So we are taking an evidence-based approach. Dr. Vinay Prasad and I outlined it in the New England Journal of Medicine, and we're basically saying that there's got to be a risk-stratified approach. That is high risk versus low risk. Does a healthy 12-year-old girl today need another 60 doses in her average lifespan? That is a scientific unknown, and we'd like to see a clinical trial before approving the vaccine for that reason.
How does removing the recommendation, though, increase choice, increase the patient's ability to come to a decision with doctors, since so many insurance plans and programs depend on ACIP and CDC recommendations in order to provide the no-cost, low-cost vaccines? Isn't this removing choice effectively from patients?
Now, the promise of the Secretary Kennedy is to let people know that vaccines will be available if people want them. You will be able to get a vaccine if you want them. So that's a decision between you and your doctor, and each individual insurance company has their own policy. Look, some insurance companies don't pay for important cancer treatments that for patients that I saw as a cancer surgeon. And so that is another entire issue that's unrelated to the FDA.
Okay, so insurance, so the fact that private insurers, employer-sponsored insurance plans, Medicare Part D, Medicaid, the Vaccines for Children program, all of them link providing no-cost vaccines to CDC and ACIP recommendations. That removing the recommendations doesn't remove in some way the choice that patients can make, especially the vulnerable patients who may not be able to afford to pay.
That's right. It does not remove the choice. And our job at the FDA is, and this is a charge by Congress, is to look at applications that are submitted to us and determine what is safe and effective. And so that is what we are committed to. I think there was some lost trust in the FDA when there was a new policy that basically said for a young, healthy 15-year-old boy, we were going to rubber stamp a COVID vaccine without a clinical trial every year in perpetuity, and the kid must get it. And I think we're saying we're going to be less absolutist when there's no evidence. I think the most dangerous thing you can do in public health is to demand something of a young, healthy individual when the evidence is just not that supportive for a new virus that creates a new protein and a new vaccine that creates a new protein where we haven't had a clinical trial in over 4 years. And those results in children were mixed back 4 years ago.